Hello everyone, I want to describe the brief lectures about the antiarrhythmic drugs after describing the angina pectoris disease. So before going into the detail of the antiarrhythmic drugs, I want to describe what is the normal conduction pathway of the cardiac muscles. Into the cardiac muscle, there will be a sinoatrial node present on the right atrium, and its conductive velocity sends the impulse to the whole of the atria and causing the atrial contraction, and there will be a P wave will be generated on that portions, and then it reaches to the atrioventricular node. There will be a delay on 1.15 seconds of it, and then move into the bundle of phase and goes to a Purkinje fiber system and whole of the in these conditions. But before going into the Purkinje system, there will be a ventricular contraction and QRS will be produced, and then T wave is produced due to the ventricular relaxations or ventricular repolarization conditions. The whole of it about to the normal conduction pathway, if it does not describe that, this will be related, that will be face problems about it. So be careful. And then we move into the what is arrhythmia. So go into the disturbance in the heart rate. There will be a high heart rate, there will be a most condition, there will be a most conductivity, rhythm, impulse generated to the conductance, and this disturbance can lead to alteration in the overall cardiac function that can be life-threatening. If we cannot manage, there will be life-threatening infections. And then into the antiarrhythmic drugs to the cardiac to treat the cardiac arrhythmias. No, it is not to the vein stone like blood vessels. Cardiac arrhythmias weaken effects on whole of the cardiac muscles. So this is most be remember always. So what is the mechanism of the arrhythmias? There will be three types of the mechanism to arrhythmias. The first one is related to abnormal atomicity, related to sinoatrial node will be contract faster. Sinoatrial, and most will be impulse generated and goes to the heart, and more will be contractions and delayed depolarization. There will be a prolonged action potential, we can say, and the prolonged action potential. Due to a prolonged action potential, more will be contracted conditions and more will be arrhythmias conditions. And the third one is a re-entry phenomena. We can say this one is a re-entry phenomena, that impulse comes at the ventricle and moves into that portion. This is a normal conditions. But in abnormal conditions, impulse come and goes to that portion. There will be a blockage on that portion, and then impulse moves on to the single unidirection and retrograde directions, and this will be a re-entry phenomena that will cause the arrhythmias about it. So moving to the arrhythmic drugs, I want to describe the phases of the action potential of the cardiac cells. There will be a 4 to 5 phases. There will be phase 0, rapid depolarization of the inflow. There will be more movements of the sodium into the, and more will be action potentials generated, and there will be depolarization conditions. And in the second one, there will be a phase 1 partial repolarization, inward sodium currents. There will be a partial repolarization, not a complete conditions. And the third one is a plateau condition. There will be a slow inward of the calcium current. There will be a membrane and more movements of the calcium, sodiums, and calcium movements to cause the depolarizations. And the calcium currents, this will be inactivated, and potassium will be moved out about it and causing the repolarization. There will be a phase 3 and phase 4 related to a pacemaker potential, so sodium inflow and slowing potassium outflow and arrhythmicity. This will be a most important. Learn about the whole of about it to remember the whole of the cardiac cycle, how it will be done. Before we can describe individually drugs of the classification of the antiarrhythmias, there will be a class 1 sodium channel blocker. It will be divided into 3, 1A, 1B, and 1C drug. In the class 1A, there will be remember like quine and present in the pyramids, and like procainamide and disopyramid structure. There will be class 1, and second one is a lodocaine, and third one is related to a flecenoids. So we can describe individually on the basis of the different conditions. And class 2 is a beta-adrenergic, and class 3 potassium channel blocker and calcium channel. We can describe individually by one. So remember, this one is a calcium channel blocker. This one is a calcium channel blocker, and this one is a class 1A related to a quinidine, like a procainamide, disopyramid. This is the most important, and the mechanism about procainamide is related to a binds to open and inactivate sodium channel, and inactivating the sodium channel and prevent sodium influx. Sodium influx will be prevented and rapid upstroke of the phase 0 conditions, and this will be related into action potential, which will be a PR interval may not be decreased or increased, QRS duration will be increased, and Q2 interval will be also be increased. And the second one is lodocaine or lignocaine, that will be related to a class B group and mostly related to a Q2 interval will be decreased in this condition. And the third one is little effect on repolarizations, and flecenide is most important, and in these conditions we can say that there will be a QRS duration will be increased and PR interval will be also increased. So we remember this one is a class 1 drug, remember, be careful about it. This one is a class 1 drug, and QRS Q2 interval will be prolonged, and this one is a action potential, this one is a increased action potential will be increased, and effective refractory period will also be increased in these conditions. And in the second condition there will be a decreased in the action potentials, and there will be a refractory period will be also increased. But in the last class 3B, this will be related to no effects on the action potential, there will be the same conditions about it. So the class 1 drug, this one is used in the atria plus ventricular arrhythmias, and especially after myocardial infarctions, and its side effects will be a lupus syndrome and headache like a tinnitus and like that. And in this first condition, quinidine will cause synchronism. Most important, this will be a generic question. Synchronism is caused by class 1B in quinidine. And class 2B, class 1B is related to a ventricular arrhythmias and post-myocardial infarction, mostly in digitalis induced and their arrhythmia, and given in mostly intravenous or intramuscularly, and mostly cause cardiac depressant like CNS depressant on about it. So in last we can say class 3, that is a flecenide. But remember that class 2B like lidocaine is used in ischemia also. It's not used in ischemia, but it can be used in the ischemia. In the third class, there will be related to flecenide, and it also a sodium channel blocker, and it's used in the refractory arrhythmias. So we can say and increased excitement about it. So move on to the difference about it: moderate sodium channels, mild sodium calcium channel, and different causes that we already described in the action potentials. We can remember about it. Now moving to the class 1, that will be so simple. We can remember that sodium channel blocker will be also used in these conditions, and the otherwise quinidine, procainamide, diazepam block the open of the inactivated sodium calcium channel. Now we move on to the calcium in the beta blocker drugs. That will be a beta 1 blocker or beta 2. Beta 1 is related to present in the receptor present on the kidney and also on the heart. So metoprolol, propronolol is blocks the beta receptor slow pacemaker activity and post myocardial infarctions, prophylactically used about it. So it's caused the bronchospasm and cardiac depressions, atrioventricular block, and hypotensions related to it. So beta 1 is directly acting on the cardiac muscles and to decrease the arrhythmias, suppression, depress myocardial contractility, atomicity, conduction velocity, and used in the supraventricular arrhythmias and exercise and hypothyroidisms. So move on to the different class 1 drugs is related to amiodarones. This will be a most important class about it. Remember, always remember about it, that I have remembered by mnemonics about it. A represent for anti-anginal drugs, and M represent for multiple actions, and I related to iodine containing organ like causing hypothyroidism and hyperthyroidism, and on prolonged use it will be causing pulmonary fibrosis, and given orally drugs. And D represented duration of action is very prolonged, and R represent for resistant atrial fibrillations, and N represent for neuropathy. And in last one, E is related to eyes, like a cornea is present in eyes, and it causes a corneal microcrystalline structures. So now move on to that iodine containing like drugs and mechanism of multiple actions. you can remember by the formula of amiodarone. So variable absorptions, many drugs interactions about it. So it's so simple about it that just remember amiodarones that I've already described about it. So now move on to the uses about amiodarones. Can be used for both supraventricular and ventricular tachycardia, and it used in the pulmonary fibrosis like on prolonged use. Like always remember, it can be pulmonary fibrosis by giving drugs many times to cause the pulmonary fibrosis. Hepatotoxicity is a minor effect, and the hypothyroidism is related to eye and death portions. So now move on to the calcium channel blocker. Calcium channel blocker is related to, say, it inhibit the L type of the calcium channel blocker, and in ischemic condition there will be a calcium repolarization will be more and worsening the condition of ischemia. So when the conditions of the ischemia will be worsened, there will be cause to inhibit the calcium channel. If we cannot inhibit calcium, there will be more ischemia and there will be condition will be more worsening. And in this condition, there will be movements of the calcium, contractility, atomicity, and mostly used in the AV conduction and mostly used in the atrioventricular arrhythmias. That will be a calcium channel blockers about it. So now move on to the main uses of the calcium channel blocker. That is a Ca mesh. What is a Ca? Ca is related to calcium. Mesh is, so C is related to cerebral vasospasm, A is related to angina pectoris, migraines that were described in the angina pectoris lecture. That will I sent you a link in the descriptions. And then will be atrial fibrillations. This will be all uses that will remember and any portions. You can remember this condition, Ca mesh, you will also remember about it. This will be a supraventricular tachycardia and hypotension. And in the side effects, you can remember that in December there will be a cool and most happy weather about it. You can enjoy it. So in the side effects, we can say like a happy December. Happy is H will represent to hypotension, and D represented to dizziness and cardiac depressant, and E represented to edema, like edema, we can say this will be related to edema, and C represented to constipation. If the patient complains that I've taken drugs of that portion and I felt constipations, that you will feel that what type of the drug will be given. You can easily say that will be a calcium channel blocker, and it will be related to atrioventricular arrhythmias to treat about it. And mostly effect the drug will be used in the verapamil. That will decrease the conduction velocity about acting on the AV node, and decreasing the contractility and decreasing the conduction velocity too about it. So this is major about the calcium channel blocker. So by making the mnemonics, you can remember everything. Like amiodarones, you can think everything, and like calcium channel blockers, you can study everything. In last, we can say this is all about, if you studied every drugs about it, procainamide, PR interval, and in these conditions you will describe that PR interval will be decreased in which conditions and QT interval will be decreased in which condition. The most effective is the amiodarone that increases everything about. If the patient comes in the emergency department and having complaints of the arrhythmias, that you have not about to complain that what type of the arrhythmias, you can use amiodarone. No doubt it has side effects mentally used, but you can use about it amiodarones to treat it. Now move on to the be ready about to solve these MCQs. It's so simple, but it's a technical MCQs to solve it. You can say 45-year-old man is being treated for atrial arrhythmias. He complains of dry mouth. And blurred visions, urinary hesitancy. Which antiarrhythmias drugs most likely taking? No, use most likely. This one remember. Like metoprolol is also anti-beta blocker drugs and can be used as arrhythmias. Disopyramide is also used as arrhythmias, and verapamil also used as arrhythmias. Esmolol is also used as athmolol. But say disopyramide is related to keyword and at that portion, dry mouth, blurred vision, and urinary hesitancy. Verapamil is a calcium channel blocker. It causes the side effect like hypotension, but no dry mouth, blood and urine hesitancy. Metoprolol is not related to anticholinergic effects. So diazopyramide is related to a sodium channel blocker and causing the blockage of the sodiums to decrease the action potential and most likely related to anticholinergic actions. So the most appropriate action about is diazopyramide. So it's all about antiarrhythmic drugs to remember by mnemonics. So by amiodarones, like calciums, like first type of the drugs, classic of the drugs, and the side effect of that portions. And the third one is related to beta blocker that we already studied in the angina pectoris treatments, and we can also use in the autonomic nervous system. It's so simple about it. So thank you so much. I request you to subscribe my channels so that our lectures and every video comes to you and enjoy it. Jazakallah.